Has your doctor or nurse suggested taking gliflozins for your diabetes? Is that a good idea? I'm Dr. Alex Gawthrope, a general practitioner here in the UK, and today we'll be talking about this group of medications which are increasingly being offered to some patients with type 2 diabetes. You may also hear of them being called gliflozins or SGLT2 inhibitors, which is an abbreviation for sodium glucose cotransporter 2 inhibitors. It's needlessly complicated, so I'm just going to call them gliflozins. If you've been advised to take one and you're considering whether a gliflozin medication is right for you, stick around and we'll dive into the details. Gliflozins help lower blood glucose levels by increasing the amount of glucose in your urine. They include drug names like canagliflozin, dapagliflozin, empagliflozin, and ertugliflozin. They work by blocking a specific part in the kidneys called the SGLT2 receptor, which is that sodium glucose cotransporter 2 receptor. Now, typically this can reduce your HbA1c level, which is the most commonly used measure of diabetes control, by around 11. Although this depends on your individual circumstances and lifestyle, of course. Also, because you are peeing away calories, it can help you lose weight, typically 2 to 3 kilograms or half a stone, again, depending on your lifestyle and individual factors. But they also offer added benefits. There is now really good evidence that these medications reduce deaths due to cardiovascular disease, such as heart attacks. They also slow the decline in kidney function, especially if you already have chronic kidney disease, which we know can be a problem in type 2 diabetes. People taking these medications with chronic kidney failure are also less likely to progress towards end-stage renal failure, which is the stage in which people can need treatments like dialysis. And for those with heart failure, by taking these medications, research shows that you are less likely to need hospital admission due to your heart failure. Now, one good point about gliflozins is that they work independently from insulin, which means that they can be effective at any stage of type 2 diabetes, and they also have a lower risk of hypoglycemia or low blood sugar compared to some other diabetes medications. Now, let's talk about some of the potential side effects. Remember, this medication is making you pee more sugar away. Yeasts and bacteria can take advantage of this extra sugar, which can cause things like thrush and urinary tract infections. Also, due to the increased need to urinate and salt loss in the urine, this medication can sometimes make people feel dizzy. Now, not everyone experiences these side effects, and most people tolerate the medication without issue. Now, there are two major uncommon side effects to be aware of. One is something called Fournier's gangrene. This is a severe skin infection of the genital area, which requires immediate hospital admission. Symptoms of that could include severe pain, tenderness, redness, and swelling in the genital region, usually coupled with a fever and feeling quite unwell. The second is something called diabetic ketoacidosis, sometimes abbreviated as DKA. Diabetic ketoacidosis will cause people to feel quite unwell, often coupled with vomiting, abdominal pain, rapid breathing, sometimes confusion. It also requires hospital admission. It is important to note that these major side effects rarely occur, but they can be serious if they were to happen. Now, due to the risk of diabetic ketoacidosis, we don't recommend gliflozin should be used with a very low carbohydrate or ketogenic diet. Similarly, if you were to become unwell, such as develop a vomiting bug like gastroenteritis, the medication should be stopped and restarted once you are feeling better and eating and drinking for 24 to 48 hours. So, how would you know if a gliflozin medication is the right choice for you? Now remember, there's no one-size-fits-all answer when it comes to managing type 2 diabetes. And any medication should always be in addition to having a healthy diet, regular exercise, and looking after your weight. The decision should ultimately be made in collaboration with your healthcare provider, such as your GP or nurse, taking into account your individual circumstances, medical history, and also your preferences. However, as a general rule, if you are type 2 diabetic and you already have cardiovascular disease, such as a history of heart attack or angina, or you're at higher risk of developing heart disease, and your healthcare professional can run some calculations to check this if you're unsure, then in these situations, there is a much stronger argument for considering this type of medication. For those who want further information, I've also attached in the description a useful traffic light tool, which highlights situations in which prescribing of gliflozins is a good idea and situations it is perhaps not a good idea. I've also referenced current diabetes guidelines. I hope this video has provided you with valuable information to help you decide if gliflozins are for you. If you did find this video helpful, feel free to leave a like or a comment, as this gives me valuable feedback to help me know whether I should make more videos like this in the future.